judge, but it seems to us that the reaction to it has been okay. I think people do understand the need for us to do everything that we can do in order to keep the virus suppressed and to continue as best we can to save as many lives as we can. And we will learn, as we have been learning, with regard to other impacts of COVID-19 and responding as best we possibly can. As regards restriction of movements and whether or not something does need to be put into law, obviously that would be a matter for the government to consider. But so far, as I mentioned earlier on, the whole approach where we explain, engage and encourage and try and steer clear from enforcement, it has worked well, and we would hope it work well when it comes to restriction of movements.
Has your department sought or received legal advice on whether it should be made pursuant to a law? I'm not asking you to outline what that legal advice is, but have you sought or received legal advice on that question?
Are you referring to the question of whether employers should require employees to take leave on return from?
Well, and in particular, the fact that a lot of practical barriers are being put in place to people travelling. And I'm not second guessing your determination that that's proportionate. I asked, is it out of kilter with the rest of the European Union? And I suppose it would appear to be. I mean, I think it's implicit in what Mr. Spratt said, that we have adopted a more cautious approach. But the question of whether those restrictions should be pursuant to a law rather than through sort of administrative circulars that require, in particular, public servants to take additional holidays. It's almost like there's an intentional policy of penalising them for going abroad because they're not allowed to work from home when they come back, even though they may be working from home now and have been asked to work from home up to now. That's the question.
Thank you, Chairman. I think on the question of the approach in Ireland versus other countries in Europe, across Europe the approach isn't uniform, but I think it's correct to say that in comparison with many countries in Europe, the approach taken in Ireland is more cautious in terms of seeking to control the virus. But I think the government has set out very clearly the rationale for that approach. In terms of the restrictions or the various elements of guidance that are in place that I suppose have the effect of restricting international travel, they're based on the principle of setting out good guidance for members of society, appealing to their, I suppose, human goodwill and good citizenship to support the efforts to suppress the virus. They're not, generally speaking, based on any legal restrictions. That is, in fact, even true in the case of individuals who have been diagnosed with the virus or close contacts. So it's not, to a large extent, a legal framework, and our department hasn't sought legal advice in relation to the restrictions you're referring to.
Just to be clear, though, if an employee of the Department of Transport, Tourism and Sport decides that they're going to a country that's on the green list and they return from the country of the green list on the green list with their family on a Sunday, they can go to work on Monday morning. That's correct, is it not?
I think that is correct, yes, in the sense that a person arriving into the country from a country that's on the green list is not subject to advice to restrict movement.
If they come in from, take Spain as an example, or Portugal or Spain, on a Sunday, they can't go to work on Monday morning, is that correct? In that case, the advice is that they should restrict movement. The advice, and that's what I suppose what I'm getting to.
Yes.
Is the difference between advice and law. So they're advised not to go to work on Monday morning, but if they say, and that may be a selfish thing for them to do, but if they say that they want to go to work on Monday morning, they have a family to feed, they've just been on an expensive holiday that they've saved up for some time. They can't afford to go on a holiday every year. They bought one this year. The department I work for allows the airlines to fly in and out. So and I can't get a refund. I've tried, so I'm going on holidays and I want to work on Monday morning. Can they show up for work on Monday morning or not?
The guidance that is given to public service employers is that persons in those circumstances should take leave for the 2-week period of recommended restricted movement, which I understand is intended to support employers' duty of care in terms of the welfare
and
of
if they don't, if the employee doesn't take leave?
Sorry, Chairman, there was a
employee
violation there.
doesn't take leave.
Yes, that is.
If the employee says, look, I can't, I'd love to, but I can't afford to, I need to go to work, I need to support my family, what happens then? And I don't have any leave left this year, what happens?
I don't know what happens in that case, Chairman.
What happens in your department? I mean, I appreciate you can't answer for the entire public service, but what happens if it's an employee of the department, the Minister for Transport, Tourism and Sport, somebody in your own department? What happens?
Yeah, well, look, it's a hypothetical situation. It hasn't happened, but we will deal with it if it presents.
I suppose my question is there a lawful basis to...
Well, I guess terms and conditions of employment in the civil service are dealt with by Civil Service Circular issued by the Minister for Finance. They do have a legal underpinning, so there is, I suppose, a certain legal basis for terms and conditions of employment in the civil service. So to that extent, it has a legal basis.
Seems rather vague, but I'll take your word for that. Going back to, you don't have any confidence in testing on arrival. And like we're sort of slightly out of kilter with some other countries of the European Union in that regard. Yet you say you're looking at departure point testing. How would you differentiate between the accuracy of departure point testing and arrival point testing?
If I may, Chairman, I suppose to be clear, when you refer to the fact that we don't have any confidence in testing, and I think I did intimate that earlier, and maybe I wasn't clear, but in relation to the question of confidence over testing processes, I'm not personally an expert, nor is our department expert, so we are guided by the advice of public health experts in relation to it. And our understanding of the public health expert advice is that the case for testing is very, very marginal in terms of its efficacy in contributing to the process of virus control. I know that other countries do it, and apart from the strict public health efficacy, there may be factors at play in terms of public confidence. There may also be factors at play in terms of the potential disincentive effect to travel that a testing regime might entail. If nothing else, there is a significant cost entailed in a testing process.
Are you saying that you'd be concerned that bringing in testing in Ireland would be a disincentive to people travelling to Ireland? Is that not the purpose of red lists, green lists and all of this, to have a disincentive to travel? All this confused messaging about a requirement to quarantine, no requirement to quarantine, it might be possible to quarantine, actually we can't quarantine. Is the purpose of all of that not to disincentivise travel to Ireland?
Well, I think, Chairman, the purpose of those measures are to try and give the best guidance to citizens based on the public health advice. As part of that process, the public health expert advice has been engaged on the question of whether additional testing protocols would be beneficial. And the advice has been that at the stage we're at, and given the status of testing, that the case is marginal, but it's not excluded, and it's something that we'll continue to keep under review. We'll assess what's happening in other countries, and we will continue to engage with our public health colleagues on it.
I noticed Deputy Shannon is coming. It might be a welcome relief, I don't know, but I have a couple of more questions before I go to Deputy Shannon. If there are doubts about the accuracy of testing on arrival, my question is, you said that you're looking into departure point testing. Is it that the testing is more accurate in other countries? If we don't trust the accuracy of testing here, why would we trust the accuracy of testing in other countries?
I think the point in that respect is that if there is some benefit in testing, and that if a test delivers a positive result, it's better to have that positive result arrived at before a person comes to Ireland rather than afterwards.
Okay. The passenger locator form, you're going to make that electronic now. Does that mean then that you'd have to fill it in before you get on a plane?
Yes, within 48 hours of departure.
Right. And if you're flying, and will that also apply to ports and ferries?
Yes, that is the intention.
And buses and trains crossing the border?
No.
So, if you fly into from one of the 44 countries the UK flies to and from, I'm not suggesting that you can fly to 44 countries from Belfast. I have no idea actually where you can fly to from Belfast, but I know that you can fly somewhere. I know that there's an airport in Belfast. So if you fly to or from Belfast to any country in the world and come back, drive to Belfast, or get a bus to Belfast, or get a train to Belfast, you have no record whatsoever of that passenger, that person who's either the person who's not resident in Ireland, who's coming in to Ireland on a holiday via Belfast, or Irish people who maybe don't fancy not being able to go to work on the Monday morning and are going to go on holidays via Belfast. And that's people who are deliberately choosing to do that, which I presume you'll discourage as contrary to. But then there are people, I'm sure, in the border area who fly via Belfast. I mean, it might be there are myriad people from Belfast regularly fly from Dublin, so I presume the opposite is equally the case.
Yes, I mean that is possible. I think you're absolutely correct, Chairman. But I also think that it's very clear to people generally, and I think most people would very, very clearly understand that the advice that has been given for the purposes of protecting transmission of the virus should apply equally, whether a flight, whether an international journey is taken via Dublin Airport or via Belfast Airport.
But the question is this passenger locator form. Do you know how many people from the residents of the Republic of Ireland in a typical year, not this year, but in a typical year would fly out of Belfast or for go on holidays out of Belfast or from other UK airports?
I confess I don't have those figures.
Does the department have those figures?
I'm not sure if they can be obtained. I'm not sure if that data exists, but certainly we can look into that and see what we can provide to you. We'll follow up in writing if that's acceptable to you, Chairman.
That is, would you accept that it's typically about 30,000 people every day across the border between the Republic of Ireland and Northern Ireland?
I can't confirm that figure.
Okay.
I accept it. If you, I mean.
Well, I mean, I don't have an accurate figure. If you have a more accurate figure, I'd welcome it. But would you accept that there's no record whatsoever of? And I accept that the majority of these people are travelling from a couple of miles one side of the border to a couple of miles the other side of the border for work, family reasons, whatever. But then there's also a large cohort of people who decide to come to Ireland from the United Kingdom or from many parts of the world via Northern Ireland. Would you accept that?
Yeah, I think that's correct, yes.
I suppose my question is, whether the measures, the very restrictive measures that are being put in place in the Republic of Ireland is proportionate given the amount of travel via Northern Ireland and the complete lack of any record of people who are travelling via Northern Ireland. Whether Larne to Stranraer or from... are there two airports in Belfast? I don't know whether there are two airports that have international flights or not, or maybe one closed for another. I don't know. But there's certainly an airport in Belfast. We're clear about that.
There are two, yes. And of course, what you say, Chairman, is correct, that there are people who can travel via those airports to and from the Republic of Ireland. That's absolutely correct. And for those travellers, clearly, that being a different jurisdiction, the requirements in relation to the passenger locator form and follow-up measures won't apply. But if I understood correctly, I think your proposition was having regard to the fact that possibility exists, should the requirements that apply here in relation to the passenger locator form and the guidance in relation to restricted movement, should that be applied? And I think without having the precise numbers, it's clear that it is still the case that the majority of travel to and from Ireland will take place through Dublin Airport. So in terms of virus control, I think the argument there is evident.
Okay. Well, thank you very much for all of those clarifications. I just wish to ask one last question. I see Deputy Shannon here. The public service vehicles could once. Why have the areas in which they can be tested, the centres, the number of centres in which that testing can be carried out, being reduced? There was a time, for example, that you could test in almost every DOE testing centre, and now you can just do part of the test in Ennis, for example, and you have to go on to Limerick or Galway for the rest of it. Is there a particular reason around that?
Chairman, I'm sorry now, I have to admit, we were limited to 5, so I don't have my colleague from the road safety side of the house and the roadside, so I'll have to come back to you in writing on that, if that's okay, Chairman. I apologise that I can't address it here.
And I thank you. I would appreciate it if you could come back to me in writing. Deputy Shannon is here. I'd like to give him the floor. Thank you.
Thanks, Chairman, and thanks to our members from the department here today. Could I go back to the issue of airport testing? And I've been out in the media last week and earlier this week requesting that we do PCR COVID testing, which I believe is eminently feasible at Dublin and the other airports. And I've made the point already, if we don't do it at the airports, we'll end up doing it in community here a little bit later in the year. So I note the comments that were made by the previous speaker, where he said that I think the medical advice was that the testing regime wasn't robust enough or didn't capture enough, and therefore essentially wasn't almost worth doing. So I point out that PCR COVID testing, which is what we do in the hospitals presently, is about 80 to 85% effective. And I'm not sure that there's any test anywhere that's more effective than that. So essentially we decide when we test that we're going to miss people who are asymptomatic at the time or very early on in the infection. They don't show up, and essentially a subsequent test, if they have symptoms, is how we establish the fact that they're COVID positive. And then we go through all the rigmarole of contact tracing and all the rest of it. But I heard what you said about testing in outside airports or foreign centres, and I'm wondering, has anybody looked at the costs of doing that, what we're proposing to do abroad, that we could probably do now quite easily here, and we certainly know the costs of doing it here. I'm not sure that we know what we're going to pay for doing it abroad, and we will still have the same amount of slip-through regardless where we do it. So maybe if somebody wants to take that for a moment, please.
Maybe if I could just give some remarks and ask Fintan to address if there's anything else that he wants to add. I guess the benefit of departure testing, Deputy, is that first of all, the person would be required to take the test herself or himself within 24 to 72 hours before actually departing, and that result would be presented to the INIS on arrival at Dublin Airport. And obviously the person wouldn't travel if a negative test, if a positive test was returned. The benefit of that would be that the person would not have actually travelled, would not have potentially come into close contact with all of the fellow travellers, and therefore we would be avoiding a situation where if you had entry testing and somebody became positive or was tested positive, that we would have to do all of the follow-up that would be required with the fellow travellers. So there is that benefit. There is also the benefit of the cost being borne by the traveller, and there is also the issue with regard to capacity. So the capacity for testing on arrival doesn't arise if you have departure testing. So that's why we're looking at that as closely as we are, and there is the potential not only to do a high street test where a person would purchase their own test and do it, but we could up the standardisation of that through colleagues in the Department of Health, National Public Health Emergency Team and the Health Protection Surveillance Centre, so that we would set the bar relatively high and apply that to departure points. And again, that would address issues with regards to capacity, credibility, obviously, and cost. So that's why we're looking at that as hard as we are.
Can I say, I'm sorry to cut across, Mr. Spratt, but my time will be limited here. So I accept the logic of what you're proposing, okay? But the next question is then, if this is the route we're going, A, are those tests available at the points of departure or prior to the people departing? And B, when do you see something like this being put in place?
Yeah, still being considered, Deputy. Yes, they are. As I said, it is possible to purchase reputable COVID-19 tests and to take them yourself in most countries around the world. So yes, they are available. And were we to move to the Irish applied standard, that is something that is being considered in consultation with colleagues at the Department of Health.
I think one thing,
that will take some time.
There's obviously potential there for people to, I suppose, defraud that test in a way if you're presenting your laminar test flow or whatever it is you bring in your show and you say, here's the result I got. It would be like bringing a pregnancy test kit with you to show somebody the stripes on it, because that's effectively what you're addressing in those diagnostic test kits that you're talking about. That's essentially how they work, unless you have another one, and you may have, that I don't know about. I'm not an expert. I know a little bit about it. But anyway, having said that, I think the most important thing is that the department needs to flag, if that's what's being proposed, that it get proposed and it gets done, because we need to do something with certainly the foreign travel, particularly from the US and South America in particular, and other countries that are not on the green list. But going beyond that then, and we've heard from the aviation sector here this morning, and we've more or less, I think it has been established that getting on a flight and assuming that people don't have COVID, but for those that are asymptomatic, the transmission rate would appear to be very low because of the negative air pressure in the cabin, because of the recirculation and the HEPA filters and all of that. So we can assume that we're saying it's safe then for people to get 6 hours and be beside one another wearing masks. And the question then is, why are we not doing that for the taxi sector? Why are we not mandating masks? And I heard the previous contributor saying that a taxi man can ask people to put on a mask. I would remind you that a bus driver was kicked to death in France a couple of weeks ago by two people full of alcohol because he asked them to wear a mask getting on a bus. And I don't think it's operationally possible for a lot of people, particularly for those who are earning very little money, if they go back out taxing, to start asking customers to wear a mask, because the first thing the customer will say, I don't have it. Secondly, the taxi man will have to supply it as his expense, and even then they may not wear it. So I think it would be far better if the department took a leadership role here. And I know you'll go back and say that the medical advisors and NEFIT and everybody else hasn't come to you and said it's a good idea. I think we need to look at what's going on in other countries. And you're a lead agency here, and I think you're quite in a position to come out and say it's the position of the people gathered here around this table this evening, the leadership of the department, to say we're making a strong recommendation that masks should be mandated for taxis. Is that a reasonable position?
Yeah, just before we go on to the masks for taxis, I guess it is important to note that we are learning as we go, that we are at the start of a lot of the measures, particularly when it comes to international travel. I suppose the engage, explain, encourage approach that we have taken up to now has worked quite well across the board. If somebody were to take a test at departure point and be positive and decide, to hell with this, I'm going to travel anyway, and to decide themselves to put people in danger, that would be, pretty serious decision for that person to take. It would be contrary to what we've seen in terms of, almost universal compliance with requests to be in this together, and we would expect that we would continue to see good compliance along the lines as we have seen up to now. Deirdre, do you want to address the issue with regard to face coverings for taxis, please?
Yeah. You're right, Deputy. Face coverings are important, and we are moving to introduce mandatory face coverings in taxis. The first priority was to arrange it for mass transit, which is the buses and the trains and the trams, where you have large numbers of people moving together. and that has been introduced. We understand the compliance levels are very high. The NTA have been in constant touch with the operators of the services, and we're hearing of rates typically in the mid-90%, and in some cases 100%. Particularly strong compliance when the vehicles are more full at the peak hours.
I don't mean to be rude. I'm very limited on time here, so just.
Sorry, Deputy, move on.
I'm glad to hear. What I would say to you is, please, urgency here. I know you're looking at it and you're considering it and you're analysing it. What people want to see out there, and I think for public confidence, you need to demonstrate urgency. That, you know, to say to us here in committee today that you're looking at it and you want to get it done in the public transit, there's no reason why it cannot be done across the board. Ask government if they have to put some emergency legislation in place to mandate it. That's what needs to be done. With respect. And ask you also, it came up here this morning with taxi drivers about screens, that the NTA essentially don't have any preferred screen to give protection between the drivers and their occupants, and yet at the same time if somebody puts in a screen they're essentially breaking the law. They probably have an insurance issue. Can we not find some common ground here to basically make recommendations that this is not rocket science? I'm responsible for two initiatives that were taken up by NEFIT. I'm not an expert, but if I go and look at these things and I talk to the people concerned, logic would tell you what we need to do, and they can be done. And I'm frustrated asking you the questions here today why these things can't be done, and listening to what we're listening to. And I accept that the department has a remit here that they have to look at it in the round, but this is not rocket science. These are simple measures, and they will give confidence to the public, and they will give confidence to employers, and generally show the country that we are trying to go in a way to mitigate this disease and not make simple solutions so difficult to implement. You can come back to me, please, in writing about the screens for the taxis. Can I read something into the record here, vis-a-vis a person who has a limo business doing weddings? Okay, this gentleman. The structure for limo driving for weddings that this gentleman has, he has vehicles that must be NCT'd every 6 months, and the cars are then booked in for a suitability booking, inverted commas, which is an inspection to grant the licence. They pay this every 6 months for the service and licence. This gentleman paid over the phone for a suitability test, and then it got cancelled due to the lockdown. He was refunded for the booking, but he had paid out for the NCTs on his cars in the lockdown, which had been idle for the last number of months. He has now tried to book again, and he is being informed that he has 7 days in which to complete the booking, and if not, he has to have the NCTs done again. He has received no reimbursement for the NCTs and is now expected to carry out 13 NCTs in the next 7 days or face a €500 fine per car. Can we please address this type of nonsense? And this lack of joined-up thinking? We have people out there who are at their wits' end in business, and we have this government regulation in different departments who do not talk to each other, and small business people are being hammered time and time again. They cannot get into business, and when they're up in business, all they have is one regulation to meet after another. Now, I implore you, please, the same with driving tests. I have a young lady who's graduated college. She has a fantastic job, one of only 3 in the country. And she needs a full driving licence in order to get this job, and she cannot get a test. And by September, she's been told by this multinational, if she doesn't have a full driving licence, they cannot offer her the job because it's a contract of employment. And I'm running around trying to see how can we get her a driving test, and we're told there's no safe way for a driving test to be completed. Now, I would say dual driving cars could have a screen placed in them, and we could certainly get emergency driving tests done. Is that an unfeasible ask again? I ask of you.
Deputy, thanks for bringing those issues to our attention. I think it is really important to remember that COVID-19 is throwing up an awful lot of challenges to the private sector, to the public sector, to the civil service, to state companies and to state agencies. I would, and it is really important to remember, we are doing really, really well when it comes to the suppression of this virus. If you look at the stats, we are in the leading pack when it comes to suppressing the virus, and that is down to how the Irish public have responded under the leadership of departments, including our own department. It's not the case that we have solved every problem, and there are still plenty of problems to be solved, including the problems that you've mentioned there. But we will redouble our efforts and do everything that we can do in order to try and identify those issues and solve them where we possibly can. So you've brought some issues to our attention there. We will look at those and we'll see what we can do to try and resolve them as quick as we possibly can.
Well, Mr. Speaker, I say I don't wish to argue the epidemiological outcome of COVID and how we're dealing with it, but I do think what would be of benefit, and this committee is not the place to do it, but there are TDs and other representatives around Leinster House who will be very happy to meet with the department, and we'll be very happy to bring these issues, and some of them are quite small. A quick decision could get them answered, okay? And I think that's what all of us want to hear. We want to see movement. I accept it's difficult, and as you say, there's new learnings, but we're all on a learning curve here, and it would be better if we learn it together, and we can do that by having engagement, and I'd seek engagement with yourself and any other deputies on the committee that want to come with me until we try to get these issues spoken about and see, can we come up with some resolutions for people, please?
Happy to do that, Deputy.
Thank you, Chairperson. I'd just like to, at the beginning, I think, you know, there's a dog walk going on at the present time out in the Convention Centre, and I think there's somewhere along the line we're in here, we're meant to be voting as Dáil representatives of our constituency, and I think there's a bad mistake we made here, and in future we can't be missing our Dáil activities and reclassing with the activities here. This is a very important committee, I respect that, but we should be allowed a vote.
The only thing I can say is that, you know, everything we do is run by the business committee of the Dáil. We don't know, as we make our plans going forward, up to now we have never clashed with the Dáil sitting. We're a Dáil committee. We do our best, but, you know, it's up to the business committee in a way to alert us to these.
Yeah, and maybe we should write to the business committee, I appreciate through the chair, that we would do that in future, that we wouldn't be losing our right to vote. It's important. We're elected to our constituencies to do that, and be here too in the presence. I know it's a difficult time, but we can't be in two places 15 minutes apart and be in one place at the same time. Look, in relation to taxi, I'd like to thank Chairperson, and I'd like to thank our guests for being here today, but in relation to taxi drivers, and I spoke about this earlier on too, are suffering extreme stress, and taxi drivers and private bus operators, they're going through a very difficult time exactly during the Covid-19, as they have seen their incomes, we say taxi drivers have wiped out. Nonetheless, they have to keep their cars taxed, insured and licensed. They are fearful of cancelling their insurances. They may find it very difficult or impossible to get insurance, or a renewal could see their premium inflate. Many drivers are over 66 years of age, working full-time, paying income tax, but because of age discrimination were not able to avail of the Covid-19 payment. Significant numbers of drivers have been in the business for 40 years and having paid exorbitant fees for their taxi plate under the old system are still bearing this very significant financial burden. To consider repeated costs, the taxi licence costs $250 for 5 years plus $125 per year for the vehicle licence. And what I'm saying is, can existing, we'll say, licence holders that are over 66, can they be given some bit of an incentive or free, maybe it should be made free to drivers over the age of 66? That's just one question. Then there's another question I have, regardless of the condition of a taxi. It has to be taken off the road once it's 10 years old. Drivers have to upgrade their cars to keep the licence active, and in the current business climate, the car is predominantly just parked up during these difficult times. In these exceptional circumstances, could the taxi age be increased from 10 to 15 years to ease the financial stress? And also, does the NTA have surplus monies collected from taxi drivers over the years, and if so, could these funds be made available to support drivers with car upgrades? These grants are already available for wheelchair taxis, taxi drivers, need support, and it is needed now. And the final question for now is, was there anything in the stimulus package for taxi operators or for private or independent bus operators? And that's a question I asked this morning. The unions were saying that they didn't see anything in the stimulus package. A lot of these operators are going out of business. I'm worried that there was a zero. Nothing in the stimulus package, so you might be able to answer those questions for me, please.
I'll take those. If I can start with the last one. About initiatives for the private bus sector first. You may be aware that on the 25th of June, the government made a decision to introduce a new system of temporary funding supports for the commercial bus sector. So this is operators who provide typically scheduled bus services, but they're not part of the PSO regime because in normal circumstances they make a profit from their business. But at the moment, because passenger numbers have been hit so hard by the COVID emergency, they aren't in a profit-making situation, and the situation that you described, they've high costs, they need to keep the services running. In this case, we're talking about services where there's a strong public interest for the service to keep running, because those services are providing a facility that the travelling public needs, particularly people who are either essential workers or others making necessary journeys. And to that end, the government made a decision that on an exceptional basis, for a period of 6 months, they would introduce a new temporary funding support arrangement. It's being done within the provisions of EU and Irish law. It's been administered by the National Transport Authority. They're putting in place contract arrangements with relevant private sector and other commercial operators, where they make a judgment that the services that they provide, that there is a public service justification for the continuation of those services. So I think that's a very significant feature. You were asking also about the stimulus package. I understand that on the tourism side, specifically for the coach tourism business, there was an initiative that has been announced as part of stimulus, which the Minister for Tourism is progressing there. In relation to the age of vehicles for taxis, and also the question of licence fees for certain taxi drivers, they're matters, you might be aware, that come within the ambit of the National Transport Authority under legislation passed by the two houses in 2013. The NTA is the regulator for the taxi sector, so they've statutory independence from the department. We don't have a role in relation to areas where they make decisions, and those two issues would come within their remit. However, you might have been aware from the comments we made earlier that the Taxi Advisory Council has, within the last week or so, made a report to the Minister and the Department, which was encouraged when the Minister met the Advisory Council a number of weeks ago, the previous Minister, that they would come up with their report, having had a look across the sector at what needs to be done. They've come up with a list of measures that they think are relevant. Some are relevant to the Department, some to the NTA, and others to a few other departments. There is an engagement next week between the Department and the NTA with the Taxi Advisory Committee to give preliminary feedback on those proposals that have been put forward and which are possible. Some of them will be possible, some of them won't. A few indeed are already underway. You asked about grants specifically for the taxi industry. There aren't initiatives underway in that regard, but there are within the stimulus package, and indeed, I suppose more generally, in the horizontal business supports that have been introduced by government over the last number of weeks and few months. There's a number of initiatives that are relevant. Obviously, the pandemic unemployment payment is very relevant to those who are not currently working, that have ceased working in the sector temporarily because of the emergency, and that, as was announced yesterday, is going to continue for a considerable period ahead. Specifically with a business focus and for helping people with their business costs, there's Restart grant available, and there's an enterprise support grant. There's also some credit guarantees in relation to businesses that need to undertake loans. And there's also, and this one probably doesn't get as much coverage, but I think it's probably one of those things that can be very helpful to small businesses such as taxis or others, which is advisory supports and advice about things like financial planning and business continuity and how to, get going and how to cope with the business challenges. There's no way that we're underestimating the business challenges. They're there, they're very real. They affect the taxi sector, indeed they affect practically all sectors of business in the country. And I think that the motivation to be of assistance and to help business as best possible is what's underlying government policy in relation to things like the stimulus package and the range of horizontal supports that have been announced. I hope, Deputy, I've captured the main points that you raised there.
Yeah, absolutely. And if I have just a minute more, as you can understand, the impact on finances of operators has been disastrous. Coach tour operators, traditionally plan their finances on the basis that they need to cover their operating costs throughout the winter period until the season commences again in the following March. The timing of the Covid-19 means many of them have no reserves left to enable them to survive the crisis until the revenue starts to flow again in 2021, which we hope. The tourist season. What financial support mechanism do you think should be put in place when the turnover for the coach, tourism and private hire is €250 million and their fixed costs amount to 17% of this figure, which indicates that the need for a yearly subsidy requirement of €42.5 million. What other measures can be put in place to keep this vital part of our economy in business?
Deputy. Just in relation to the tourism supports, first of all, the Minister for Tourism did announce today that additional funding would be provided, £10 million fund for coach tourism business continuity. This fund will be administered by Fault Ireland to assist the coach tourism sector. And just, Deputy, you have mentioned in terms of their impact, and it has been severe. Ministers for Tourism earlier this year established a Tourism Recovery Task Force. And just this morning, although I wasn't there myself and I provide the Secretariat to that task force, coach transport, car hire and chauffeur service presented to the task force this morning with their concerns and with their thoughts and ideas about survival and stabilisation and the long-term sustainability of their sector. So certainly, as I say, their thoughts and ideas will have been heard by that group this morning, and we would hope to incorporate any of their recommendations in the final report to the Minister.
Okay.
Thanks. Look, I just have a couple of final questions, and I'd like to thank you very much for answering all of our questions. I appreciate the questioning has possibly been more in-depth than usual because of the more limited number of deputies here than usual, for the reason that Deputy Collins outlined. And I should add that Deputy Catherine Murphy specifically sent her apologies, but having spoken to other deputies, they also regret the fact that it all is going on in the convention centre, and we're here in the Shannon Chamber, and none of us have the gift of bilocation. The departure point testing, just a couple of questions on that. Is that being looked at as an alternative to isolation on arrival in Ireland, or an addition to isolation in Ireland? And secondly, will it apply only to, is it envisaged that it would apply only to incoming passengers, i.e. non-Irish residents looking to come to Ireland, or would it equally apply to Irish residents who've gone abroad and are looking to return to Ireland? And if it does, will it even extend as far as people who've gone abroad temporarily for a holiday and are looking to return? So that's 3 questions on the departure point.
Chairman,
or maybe it's not at a sufficiently advanced level.
That's the answer, Chairman. This is something that the government addressed in its meeting this week, which signed off on the green list, and arising from that government meeting and decision, we have been asked to look into the efficacy and the potential for use of departure testing. So we're at very early stages at this stage, and it'll be another couple of weeks before we come back with any recommendations.
Okay. Then on the green list, it contains some very large states with a very regionalised approach, and it doesn't contain other large European states with an equally regionalised approach. I'm thinking of maybe Germany, France, and Spain, which aren't on the list, in Italy, which is, but there's huge variances within all 4 of those states on the incidence of COVID-19 in various regions of those states. So my question is, would you be looking at a more nuanced or more regionalised approach going forward, or not?
No, is the short answer to that, and the government has decided that it will be taking a country-specific approach to this. The difficulty that would be involved in taking a regionalised approach, it would just make it a little bit unwieldy, to be perfectly honest with you. So the smallest unit geographically that we're using now will continue to be the country approach.
Okay, Okay, so I mean, even though you have sort of Corsica and Sardinia right beside each other, with they're relatively similar islands to all intents and purposes, one is on and one is off, but because they belong to, you're just taking country by country rather than a Europe or the regions approach. Okay, and look, I'd like to thank you very much for coming and answering all of our questions. Sorry, Deputy Shanahan, we just come back.
Just come in quickly, Chair, if I may. I'd like to thank Mr. Spratt for agreeing to provide, hopefully himself and some of his seniors, for a meeting, and I'll try and organise some of us here, and we'll try and get that done quickly. I think that would be very helpful. Could I just point out one thing with respect to the luxury coach sector? I believe there's an anomaly vis-a-vis the coach service in Northern Ireland, which obviously does tours around Ireland, and we're very grateful for that, but there's a substantial difference there in terms of VAT, the dealing of VAT between the Irish coach tourism and private bus operators versus the north of Ireland, and maybe that's something that you could look at in terms of competitive grounds, because it is a significant advantage. And just the other thing is that some of the newer bus fleet, I understand, as you probably know, there's no open windows on buses anymore, so they're requiring recirculated air through the air conditioning system. And some newer buses may have the ability to put HEPA filters on quite easily. Older buses, it's a more involved job. This is a modification to the existing air circulation system, but again, perhaps it's something that the department need to have a look at in terms of passenger safety. For some buses it's easily done and not too expensive. I think around €700 to €900 for the filter. For older buses I think it's probably a lot more, but I think again it's an initiative that should be looked at. We try to get our fleet up to standard and get a reasonable level of infection prevention going in the private bus sector. Thank you.
Thank you, Deputy, and happy to meet, and we might try and arrange that for next week if you wish, but keen to understand challenges and keen to do our best to try and resolve as many of those issues as quickly as we possibly can, so we'll certainly be in touch with your office to get that set up.
Thank you very much. Thank you very much indeed.
Okay, that's it. Thank you very much, Mr. Spratt. I'd like to thank you and all of your colleagues for coming here this afternoon, for the information that you've given to us, and I suppose mostly for explaining the reasoning behind many of the decisions that are made. It's very much appreciated. And on behalf of the colleagues who are here to ask questions, and also those who couldn't be here because they're down in the convention centre anticipating a vote, I'd like to thank you and your colleagues very much. With that, I would like to adjourn the meeting until Tuesday at 9 a.m. Thank you.